Before we get started, I just want you to see my note card. Okay, I'm going to place it aside and we'll get started. Hi, my name is Kenzie Barrett. I am a student nurse. I'm going to be doing an assessment of your skin, hair, and nails today. But before we get started, I'm going to wash my hands. And I'm going to gather my supplies. And before we get started, I'm going to verify that you are the right patient. Can you state your first and last name for me?
Adam Barrett,
And your date of birth?
8/16/83.
Can I check your wrist scan, please? And it is verified. Okay. So before we start, are you having any concern about your hair, skin, or nails?
No.
Do you have any dry areas that you know of? No. Any redness, lesions, bumps that are mysterious, anything going on? No, that's good. Okay, before we get started, I'm going to put my gloves on. Since my patient is quite a bit taller than me, I'm going to start with a skin assessment first while he is laying down in supine position. So let's first take a look at your arm here. You can put this one down by your side. Thank you. So, as we see on the skin, the patient does have a lot of freckles, but I'm not seeing any lifted moles or discoloration of the skin. The patient's skin is pallor, which means it's pale. We can flip the arm over so you can see the pale side. And he has some areas of erythema, which is red spots. The skin is thick. It's not thin. Pain with any of that? Are you having any pain? No?
No.
The skin doesn't feel too dry or have any dry patches. The patient does have one scar right above his knee. It's pretty significant. It's kind of purple in color, but it's healed. It's healed up nicely. Can you roll over to your side so we can examine your back? Same thing on the back. We just have a lot of freckles. Nothing is lifted. The skin looks even, soft, and not too dry. Okay. Since we're right here in this position where I can see his feet, I'm going to go ahead and check his nails. And his skin between his toes is a little bit dry. So we'll take note of that. The nail beds are pink in color. They look symmetrical. They're not brittle, they're pretty firm. And we'll do a capillary refill. Just holding down for about 3 seconds. It refills quickly. He has good peripheral circulation. Okay, I'm going to go ahead and ask you to sit up. Go ahead and sit up. One other note about his skin is that if we check for temperature, it's warm to the touch, but not too hot. Okay, if you mind holding your hands out for me the other direction, we're going to check the nails. Again, his fingernails are not brittle or thin. They're not breaking. They're pretty firm. And we'll check the capillary refill. It refills back pretty quickly, back to a reddish pink color. And if you'll go ahead and make the little arch in your finger for me to see, we're looking for the diamond shape and it's there. Go ahead and hold your finger out straight for me like this. Good. And I'm going to use a measuring device to make sure that we don't have any clubbed fingers going on. Good. And we want to check the nail bed. which is at 160 degrees. While you're sitting here, one other thing I would like to check on your skin is a Tugger test. And it lays down. He has good results with that. That means you're not dehydrated. Okay, we're gonna move into the hair examination. Before we move over to where I can examine his hair on his head, we're gonna look at the arms. They're evenly distributed, symmetrical. The hair is in appropriate places in his legs, arm. He also has facial hair, which is of normal texture. The hair on his arm is of normal texture. It's a lot thinner and not as coarse as the face. Okay, we're gonna move over to the chair where I can assess your hair a little bit better. You can start by facing this direction. Have you noticed anything in your hair that's abnormal?
No.
Okay, I'm just going to do some examining, looking for any alopecia, dandruff. Of course, there's no lice. Artinia capitis. We do have animals. The hair texture is thin, but it's not too dry. It feels normal. It's evenly distributed. He has brown hair. And it looks good. Okay, you can go ahead and turn back around. During this time, I'm going to check my note card. I think that we got everything. Everything looks good. We checked for lesions. We didn't find any lesions or anything abnormal. Just a little bit of dry skin. So you can correct that by using some moisturizer, some good lotions. Continue using good shampoo and conditioner for your hair to make sure it stays moist and not too dry. And if you have any other questions, you can follow up with your physician.